Hello, I'm Dr. Steve Reiners, optometrist and owner of Complete Family Eyecare. And today we're going to talk about Kirby Puckett. Right there, Kirby Puckett. Anyone living in Minnesota, myself growing up in Minnesota in the late 80s and early 90s, knew the name Kirby Puckett, even if you're a modest baseball fan. Kirby was part of the Minnesota Twins. They won the World Series in 1987 and 91. And actually, this is pretty cool. This is a Homer hanky from 1987. Actually, this belonged to my wife. And so everyone take their Homer hanky to the World Series and wave their hanky, so I was kind of a collector, so that's pretty cool. But anyway, Kirby was part of that great team that won two World Series for the Minnesota Twins back in the day. And unfortunately, in 1996, Kirby woke up one day and he had completely lost vision in one of his eyes. And it's impossible, well, very difficult to hit a 90-mile-an-hour fastball with only one eye. So it was definitely a career-ending potential with this type of vision loss. And as it came out in the press at the time, Kirby did have glaucoma. Normal range and the pressure in the eyes between 10 and 22. And from what I read, his pressure was in the low 30s, which isn't a terrible glaucoma, and that because, in most people, a slow progressive loss of vision over the course of years and decades. But this was a case of lost vision in one eye overnight. So actually, essentially what happened to Kirby Puckett, he had a central retinal vein occlusion, which essentially is a stroke in the eye. And when you have glaucoma, pressure pushes down on the blood vessels on the retina itself and the inside of the eyes. But in people who have vasculitis, have arterial sclerosis, hardening of the arteries, these blood vessels are already thinning out. The pathways through the blood vessels are already thinning out as the arteries harden up. So that's inside the eyeball. If you have pressure pushing down on this already thin pathway for the blood to pass through it, so pressure pushes down for glaucoma, it narrows even further, make it much more likely for a clot or a plaque or something to get stuck in there and cause essentially a stroke inside the eye, which is happened to Kirby. So yes, he did have glaucoma. It didn't help the situation, that's for sure. It's a bad combination of uncontrolled glaucoma and vascular disease. And then unfortunately Kirby did pass away almost exactly 10 years later of a cerebral vascular accident, a stroke, a major stroke, and I believe he was only 43 or 44 years old, so a very, very sad situation. So, takeaways, get your eyes checked and watch that eye pressure for sure. And we test for glaucoma at every eye examination. We also look at the blood vessels inside of your eyes as well too, and see if there's any hardening of those arteries as well too. Get some early signs of atherosclerosis within the eye, and then also to follow up with your regular doctor, check your cholesterol, blood pressure, and check for any sorts of carotid artery disease as well too. So things are risk factors to developing central retinal vein occlusion, which Kirby had, and was a very unfortunate situation. So anyway, hopefully this was helpful, and thank you for watching.